Good morning from my garden on this beautiful Wednesday morning with the weather turning to autumn. Today we're going to talk a little bit about time and range, and I'm dedicating this presentation to all the people living with diabetes trying their best today. We're going to start by doing a little breath technique, get your brain in the game, and actually your whole body centered and yourself into your body. So we're going to breathe in for 4 counts. We're going to hold that for 4 counts, breathe out for 4 counts, and hold that for 4 counts. Now, if you're watching this from somewhere else, you can pause the video and do a few rounds of that. What is the difference between HbA1c and time and range? So traditionally, we have used the hemoglobin A1c, which gives you an indication of what the average sugar was over a period of 3 months. So in South Africa, we use millimoles per litre. And in terms of the A1c, it gets expressed as a percentage. So for argument's sake, if your HbA1c is 6.5 or 7, it means your average sugars have run usually in the region of about 8, 8.5 on average. Okay. So whilst this has been a very beneficial tool to us, in order to make treatment decisions and in order to decide if someone is well controlled or not, just listening to the language I've spoken now, where it's talking about a 3-month average, it doesn't give you the detail of every day. And only once we'd started to get really good continuous glucose monitoring data and even flash data, in other words, getting more data points, getting a sugar reading every 5 minutes, were we able to start to develop this concept of time and range. And basically what that talks to is how much of the day are your sugars within the range that we would like them to be. In other words, how much of the day are your sugars in the normal range, which gives you less complications down the line. There are people who have an A1C of 7 in the first block, and they only have about 40% time and range. So just doing an A1C does not give us all of the information that we require, especially if we're looking at preventing complications down the line. As you can see in the first graph, although these graphs aren't well focused, the gist of it is there. You're averaging out at an A1C of 7, and overseas that 154 milligram per deciliter they use a different measuring system. In the second graph, there's more time and range with the same A1C, and in the third graph, which is where we'd ideally like all our patients to be, is 100% time and range. Obviously, this is almost impossible to attain these days with automated insulin delivery systems, hybrid closed loop pumps. We are able to get closer to this number. The other thing I want to point out about this slide is where you see those steep curves in the first graph, really steep going up and steep coming down. That is when people living with diabetes feel horrible, when the sugar is screaming climbing or screaming dropping. Symptomatically, they feel difficult. They feel horrible. They often get mood swings, feel quite ratty in their body. They feel hungry. They feel irritable. And the sad thing is what's happening in the organs and the tissues and the tiny little blood vessels is that damage occurs, especially in these stages. What we've noticed now is, especially where it's going so far from the normal, this is where we want the sugar to be, the further it's going high up or the further it's going low down, that's when damage occurs, especially in the little tiny little blood vessels at the back of the eye, the small blood vessels around the heart. And so what we're aiming for is a very nice, smooth sailing graph. not only to have a good mood, but to protect the eyes, the feet, the kidneys, the brain. So, when you're a person living with diabetes, you often feel like this, looking out over a landscape, thinking, oh my word, you know, this feels like the Holy Grail, actually getting sugars in range. So, whilst it is tricky, there are some tips and tricks, and they certainly are obviously going to be days where things are much harder. And if you think about it, there's at least 50 odd contributors to your sugar. So, time of day, your sugars can be different. Um, Time of the month, in the case of women around their cycles, weather conditions, altitude, humidity, heat, dehydration, exhaustion, even seasons, your sugars can be different. But bearing all of that in mind, what we are aiming for, and the point of this graph as well, is to show that sort of smooth graph, the bottom graph here. And this is just a tiny little tip or trick where these are graphs that are Libra data from somebody who is not diabetic, a woman called the Glucose Goddess. And she has gone to great lengths. She's a biochemist, and she's gone to great lengths to help us understand glucose excursions. The top one is where she eats just a baguette. Carbs, plain carbs, not clothed carbs, just plain carbs, and she gets this rise. She's not diabetic, but you can see her sugars are going out of normal range. They are coming back in. There is science behind using something acidic like lemon juice or vinegar in terms of how these graphs then play out. So, a teaspoon of lemon juice in a glass of water, if you eat that just before you eat the baguette, your sugars react differently. And the most powerful of these is a tablespoon of vinegar and water, and then a baguette. And you can see the graph is much smoother. So, whilst there is controversy around carbs and diabetics eating carbs, and possibly we've come from an era where we were quite strict and told diabetics you cannot eat them, you must basically deprive yourself. What's been a joy about these graphs, and there are many of them, and the Glucose Goddess has published a book. And we recently did a weekend where we had a whole bunch of diabetics went away for the weekend and ate meals together and implemented some of these tips and tricks. And they work if you've got type 1 diabetes as well. Obviously, if you've got type 1 diabetes, you're going to be bolusing, you're going to be injecting some insulin to cover for this baguette. But the combination of using some of these tips and tricks and hacks with your insulin and going for a brief, brisk walk after you've had the baguette, they all make for actually, if you're wearing a Libra or a Dexcom or a Medtronic sensor, you can actually in real time see that your sugar is not screeching up and then dropping into its boots. So this is something that you could try. What we're trying to get away from is this horrible roller coaster ride. And if you're only finger sticking 3 or 4 times, you may finger stick on all the parts of that roller coaster ride that look like your sugar is okay and miss all the ones where it's high. Or you may finger stick only when it's high and be quite disillusioned because your sugars are always high. And that is the beauty of continuous glucose monitoring, is that you can see so much more. It's in essence, you're not flying blind anymore. You've got much more information that helps you to actually get a better hemoglobin A1C, better time in range, better long-term outcome. So this is just another graph, also not greatest focus, but what I want you to see is the nice, flat, smooth graph with 95% time in range and average sugar being around about the 8 millimole mark. So, whilst finger sticking is a whole lot better than possibly where we came from, urine testing and other measures that really weren't that accurate for seeing what your sugar level is, um, the new era of actually having a continuous glucose monitor or a flash glucose monitor is now here, and it is hugely beneficial. Our next challenge is to try and get these devices to be economically viable, especially in the third world, especially to patients who do not have economic means. For me, the most important thing is to try and prevent end organ damage. Brain, heart, kidneys, feet, eyes, and the vascular system are all at risk if you have the roller coaster sugar. We're aiming for this plain, smooth sailing, and yeah, feel free to ask me any questions or email me, drleethegp@gmail.com. And I'd like to end this off by saying give yourself a break. If you've got access to being able to lie in a pose like this with your feet up against the wall and your lower half of your body on something like a bolster, it's a type of an inversion. Inversions are great for the vascular system. They really do a lot of beautiful, healthy benefit things. And a lot of us can't access things like standing on our head, but we can access this lying with your feet up against the wall, and even just 10 minutes, even just once a week, really does wonderful things. In diabetes, we're really concerned about our vascular system, and one of the great benefits of inversions is a wonderful benefit to the vascular system at large.